Welcome back to Your Health television program. I'm Dr. Lisa Hernandez and I'm your host. We've been speaking about the benefits of breastfeeding today. In this segment, we'll learn about breastfeeding and going back to work. We'll hear from two guests who will discuss resources available for women who are going back to work in Monterey County and why supporting breastfeeding for women in the workplace is a good idea. I would first like to welcome Janet Vaughan. Janet is an international board-certified lactation consultant for the Monterey County Women, Infant, and Children's Program, otherwise known as WIC. She is the Monterey County and WIC program breastfeeding coordinator. Janet also coordinates the breastfeeding peer counselor program. And believe it or not, she, in addition to her professional experience, breastfed 4 children. Janet is joined by Sara Gallager. Sara is a certified lactation counselor and a breastfeeding peer counselor for the WIC program, and she works primarily out of the Seaside office. I'd like to welcome you both ladies. Thank you for taking time out of your schedule.
Thank you.
Thank you. Well, Janet, I'll ask you some of the first few questions. Carol mentioned that WIC is a resource for women in the community for breastfeeding. Can you tell me a little bit about some of those resources and what programs the WIC program provides?
Yeah, first, Lisa, I'd like to explain a little bit about the WIC program because not everybody knows what it stands for.
Right.
As you mentioned, it stands for Women, Infants, and Children. But in fact, the WIC program has been around for at least 35 years. And it's funded by our United States Department of Agriculture. And the money flows from Washington to the states, and then the states grant the money to the individual agencies. And in our case, our agency here in Monterey County is the Monterey County Health Department. And there are over 80 WIC agencies in the state of California. And it's an income-based program, meaning that women are eligible based on how much their family earns. And actually in Monterey County, over 60% of the babies born are on the WIC program. So there's a good number of babies in our community that are WIC babies. And as far as our breastfeeding resources, we have our peer counseling program. And I'd like Sara to talk a little bit about it, and we'll maybe kind of go back and forth.
Sure. So you were a peer counselor specifically in the Seaside office, yes?
Yes,
Well, tell me what a peer counselor does.
Well, specifically, we enroll moms when they are pregnant. After that, I follow them up through phone calls. The phone calls, we talk about support and help, information about breastfeeding. That's the first step. After that, we have prenatal classes in which we teach about breastfeeding positions. We teach about breastfeeding benefits. We teach about why it's important to breastfeed, this bonding with the baby. In other words, we try to create this relationship one-on-one. And this relationship is that for the mom to know there is someone they can call in the event they have a breastfeeding question, a breastfeeding problem. I usually contact moms more often when they're close to their due date, okay? So, telling them, okay, remember what we talked in the breastfeeding class, skin-to-skin contact is one of the primary things we talk about. And colostrum, for instance, how many times a baby can be breastfeeding when they are newborns. Also, we remind them that if they need help, breastfeeding support and help in the hospital, there are lactation consultants they can, try to contact. After that, I try to contact them like the first 3 days baby is being born, so just to make sure everything is going okay, and it's more or less the time where they start, getting a little fuller, and sometimes they have questions or concerns. After that, I contact them for the first month. I try to do it every week. If they do have a breastfeeding problem, then I schedule an appointment with the lactation consultant, which also comes from Natividad twice a week, and she takes care of them. After the first month, I start contacting every month, and we follow them up all the way till baby is 6 months. So that's the basic, my basic job. So I call moms every day. I usually give them my business card, so if they need to call me, I tell them, feel free, call me. Okay, and it's very good because when I advertise the pre-counselor program and the prenatal classes, we see each other, we get to know each other. It's like a friend, that you want to contact and have enough confidence that this friend, will help you with those questions. We have a lot of moms that don't have the support within their families. Then we are there to help them.
So it sounds like a peer counselor is basically setting up a mom for success.
Definitely.
And I didn't realize that the program was so comprehensive, and it starts really early. I didn't think that you would target a mom before she had her baby. That gives her an opportunity to have all her questions answered, as well as consider breastfeeding very seriously if she hadn't already.
Exactly. Another thing we share with them during pregnancy is what are some of the risks that formula will involve. Because sometimes they get the wrong information. For instance, a mom came the other day to me and say, which formula is the best for my babies? I cannot tell that because, babies can react to different formulas differently. So we also provide that information. They have both. So they can go ahead and decide how are they going to feed these babies. So we empower them. I think, they get empowered, and then they say, if they had a comment from a friend that said, oh, breastfeeding hurt, and then we discuss and share those type of issues ahead of time, they feel confident that they, as moms, are going to be able to breastfeed these babies. And a lot of time, and that is constantly, because as soon as when they're pregnant, they're like, yes, I'm going to breastfeed this baby, and I'm gonna go for it. But then when they encounter after the baby's born certain issues, if they don't have the support and help on time, they could maybe give up. But with the PC program, a lot of mom comes back to me and say, you know what, if I didn't have the support, I think I would just give up, So that's the basic idea of having this program.
And what happens with a mom who goes back to work? It sounds like that service is provided, the peer counseling services. What about in the workplace? Are there laws? Are there supports there in the community for a breastfeeding mom?
Definitely, and then that information also is given in the prenatal classes, and then we tell them that to breastfeed a baby in the whole state of California is a right that mom have. And that we can also provide with the law. Actually, we have just recently created this the 4th prenatal class, in which we actually address what a breastfeeding mom need to do when they are going to go back working. So they get all the information about the breastfeeding law around the state of California. We encourage moms to kind of like, before they go back to work, contact their bosses and, talking, I'm a breastfeeding mom and I'm going to be needing to pump during my breaks or during my lunches. And we have, a whole range of type of jobs they do. For instance, we have a lot of moms that clean houses. So, we teach them and we tell them, how in the break between one house to another one when they are traveling, because they sometimes clean 2 or 3 houses in one day. So, at what time, they can start pumping. Usually, we usually tell them, if you take 2 breaks, in your breaks or in your lunchtime, you can do that. We have a mom that works in a hotel, okay? So in a hotel, they usually have refrigerator available. So they will go ahead and talk with their bosses, and then in the break times, they will talk about, if they can be a little bit flexible so they can take the right amount of time to pump and save their milk, okay? We have moms that are teachers, and they also go ahead and talk to the bosses. So we have, all kinds of moms that have different type of jobs.
And Sara, you mentioned that Sara's in Seaside. She's our peer counselor in Seaside, and I wanted to mention also that Monterey County received special funds for the peer counseling program through USDA. It's a special fund, special pot of money, and we were very, very fortunate that this last year we were able to fund the peer counseling program in each of our sites, Salinas, Seaside, King City, and Soledad. So we have peer counselors in each site and lactation consultants, and we are just seeing our breastfeeding numbers go up and up, especially among the working moms. You know, your question about, well, what are the laws? Back in 2002, the state of California was one of the first states to pass legislation that women had the right to be accommodated while they're at work, that an employer has to work with them so that she has the right to her break time and a private place so that she would be able to express her milk. And then we were very fortunate in this country that last year with the health care reform that the legislation was similar to the state legislation but had a little bit more teeth in it in certain areas. So women in the state of California actually have a lot of support for going back to work. And then the topping on the on the cake is if you're a Monterey County employee, Monterey County is one of only 4 counties in the state of California that if you're a county employee, you have even more direction and support to be a breastfeeding mom going back to work. So as Sara said, a lot of people have not even heard of the law, and in one of our segments coming up, they're going to talk about that more, but WIC provides a lot of support to the moms for you know, going back to work and working with their employers, talking to their employers.
Well, thank you, Janet and Sara, for that information, and of course plugging Monterey County. What about, you mentioned pumping. Both of you mentioned pumping and using that as a method to be able to still provide breast milk for your infant if you're a mom going back to work. I remember pumps were kind of expensive even 10 years ago. What if a mom can't afford a pump? What services or options are out there for them?
Well, WIC provides a lot of help to moms. Since I mentioned earlier, over 60% of the babies born in our county are WIC participants. We provide breastfeeding aids. For example, I brought a couple of different pumps that we have available for moms. One is, you know, the old-fashioned manual pump, which, you know, with my last baby 19 years ago, that was really my only option at the time. But now there's fancier manual pumps, there's electric pumps. This in particular is a popular manual pump, and some of the moms still prefer to use something like this. We actually have some moms that are field workers in Monterey County that will use a couple of manual pumps since they don't have electricity available, and they will pump on their breaks using the manual pump. Here's another example. This is a personal pump, double electric, and it zips up and no one really knows what it is except the people in the know, and you can pump both breasts at the same time, and it does use a plug, but you can also plug it into your car cigarette lighter.
Oh.
So we are getting a lot of moms that maybe, again, they're field workers and they use this in their car and they plug it in if their car is with them. Or, as Sara mentioned, some of the moms that might work in the hotels or even in offices, they can take this to a designated place, which, by the way, cannot be a toilet stall. A woman needs a clean place to pump, just like when you go eat lunch. You aren't expected to go eat in the bathroom. You're not expected to pump in the bathroom. So the WIC program provides a lot of help to moms that are going to be going back to work and pumping. And then if you are not eligible for the WIC program, there are quite a few options as far as local lactation consultants who provide help with breastfeeding. And Carol mentioned the resource guide earlier in the previous segment. And so that little booklet is free. You can get that at the hospitals or at the WIC office, and that has the listings of local lactation consultants, and they also can be found on the website.
If I remember correctly, some insurances also provide for some coverage of a pump.
That's
so
right.
that's something to look for those with private insurance. Believe it or not, we're running out of time.
Oh, wow.
But I want to give both of you a chance to give one piece of advice or last message for moms. If there's a phone number you want to plug for services for mom in the community, or pieces of advice, I would like you to take the time now.
Well, first of all, I would say, even if it seems impossible to be able to continue working in breastfeeding, don't give up, because a lot of people have been able to do it. They just need some support and information. And that
we are, as a WIC program, we are there to help moms. If they didn't have anybody to turn and then ask for help, they can call us, and then we will be happy to help, and either the WIC, if it's a WIC participants, or refer them.
So it sounds like the message is, don't give up and call. Well, thank you very much, Sara and Janet, for the time. It went by really quickly. And right now, we're going to take a quick break. I'm Dr. Lisa Hernandez.